My name is Paul Kidwell. I'm the Senior Vice President for Policy at the Connecticut Hospital Association, and I'm here to support Governor's Bill HB 5058, an act adopting the Nurse Licensure Compact. Connecticut is an exceptional healthcare workforce. You've heard that already today, that is committed to serving patients every day. A robust and growing healthcare workforce is required to support healthcare delivery throughout our state. Unfortunately, the current system is not training or attracting enough individuals interested in healthcare careers that are in demand, and we all have a role, obviously, to play in supporting that infrastructure. Certainly hospitals do, and we are working individually together and with partners across the state to support the current workforce and create new ways to improve and enhance retention, recruitment, education, and training. Together, we can build on the investments already made to expand educational opportunities, ease the path to careers in healthcare, support retention, and enhance the safety of our current and future healthcare workers. Joining the Nurse Licensure Compact is required by 5058 and is an important part of maintaining the momentum we've built to grow and support our workforce. As we consider the best ways to build the nursing workforce of the future, joining the other 41 states and jurisdictions that are already part of the compact will help make Connecticut more competitive as we work to attract nurses into the state while embracing new ways to provide care, such as through telehealth. As the legislation advances, CHA looks forward to continuing to work with committed parties to ensure that nurses in Connecticut continue to have access to and the confidentiality of the Haven program. And if you're not familiar with the Haven program, it's a really important program for healthcare professionals in Connecticut, used many times as an alternate to discipline for individuals who need assistance with substance use disorder treatment, et cetera. And we want to make sure that confidentiality is maintained. And we do think there's an opportunity to do that, to both maintain the confidentiality of the program and join the compact. So in conclusion, participation in the Licensure Compact is an important tool to address workforce shortage issues, and CHA looks forward to working with the committee to couple this action with other steps to improve the education pipeline, support retention, as I noted, and improve opportunities for career advancement. And I appreciate the time this evening and happy to take any of your questions.
Thank you so much, and I do have one. So this bill is an important bill from the workforce perspective. It almost has a few issues with it. One of them being that we have looked at multiple other compacts, and for most of the other compacts that the Public Health Committee has looked at, you have some limited component to change them.
Yeah.
They've been confidentialities protected, but this one for the nurses has the least protections for the nurses, and that's part of the challenge, is that their confidential information related to Haven would not necessarily be protected the way the others are. So can you speak to that?
Thank you for bringing it up, because it's really important. So our understanding is that a nurse in Connecticut would then hold two licenses, right? One would be the Connecticut license and one would be the compact license. And so all the rules related to the nurse's Connecticut license remain in place. And the nurse then can attain the compact license and work in Connecticut, work in adjoining states. To the extent the nurse would want to avail themselves of an alternate to discipline program, they could basically turn off the interstate compact license, retain their Connecticut license, go into the program, complete the program, come out of the program, and the license would be turned back on. It's our understanding that no information is shared related to why the compact license was turned off. And so certainly would be happy to speak with you about that and go further, but we do think there's a way to maintain the confidentiality within this compact while also getting the benefits of the compact.
Okay, so I'm not sure if all of that language is in the bill right now, but we definitely are very interested to get insight into how do we make sure those protections are in place, because that's a very big hurdle. It's not something that everybody wants to have a protection. That's their right.
Yeah, and we're very interested in working with Haven, with the governor's office, to find a solution here. We think there's one where we can join the compact. We can make sure Connecticut law is clear around this confidentiality and basically protect what we think is really important while also getting this added benefit of the compact.
Can I ask for a request? If when you're having those conversations, I would love for the Connecticut Nurses Association representative to be there in that gathering when you're looking at the solution, but also have the labor representative representing the nurses in the state to be in the room as well, because this bill's actual success, when passed, is going to be dependent on that aspect too.
Yeah, I'll defer to you, members of the committee and the governor's office related to negotiations, but certainly CHA would like to be at the table and be productive in those conversations.
Good. Thank you so much for your testimony. Seeing no other questions or comments, we'll move to the next person. Thank you for being here in person.